Text me, please, if there's volume now. If there's volume now, please text me. Text me, please. Text me. You can text me on WhatsApp, please, if there's volume now, so that I can move on. Text me, please, if there's volume now. If there's volume now, please text me. Text me, please. Text me. You can text me on WhatsApp, please, if there's volume now, so that I can move on. Text me, please, if there's volume now. If there's volume now, please text me. Text me, please. Text me. You can text me on WhatsApp, please. If there's volume now, so that I can move on. You can hear me now. Text me, please, if there's volume now. Because my volume is on. If there's volume now, please text me. Text me, please. Text me. You can text me on WhatsApp, please. If there's volume now, so that I can move on. You can hear me now. Text me, please, if there's volume now. Because my volume is on. If there's volume now, please text me. Text me, please. Text me. You can text me on WhatsApp, please. If there's volume now, so that I can move on. You can hear me now. Text me, please, if there's volume now. Because my volume is on. If there's volume now, please text me. Text me, please. Text me. You can text me on WhatsApp, please. If there's volume now, so that I can. Okay, all right. So let me start. All right, welcome to Counseling Made Simple. Sorry for that. Welcome to Counseling Made Simple. Let me start all over again. This is a platform where that I started, online platform that started 2020 during the COVID, just to encourage people. I come with topics, scenario, and at the end of the day, I give coping strategy. I title it Counseling Made Simple because I want to break whatever topic I will be coming with. I want to break it down as simple as possible for people to understand and for people to be able to make use of any strategy that I will be giving. So today, I have a very, very interesting topic. This topic has been in my heart since as I was a student nurse. I've been a qualified mental health nurse now. For over 10 years, I've been practicing as a mental health nurse. And I've been coming across seeing that people still don't understand this particular topic very well. So as I'm coming online now, doing live show, I want you to send an email if you want to send an email to me, because in the past I've done scenario, people have given me topic to discuss about, because I'll be bringing professionals, because that's how I've been doing it in the past, bringing professionals to discuss about issue of life, so that people that are going through similar issue will be able to learn from it. So I'll be bringing professionals, and I'll also give opportunity in my live video, opportunity for 2 calls to come in to ask questions if you want to ask questions. If you want to ask questions, I'll give you 2 calls to come through WhatsApp, and then we can discuss it. And anybody online, if they have an input, they can put it. So this platform is to encourage people. This platform is to tell you that we have people around to support you, and to tell you that we have people that have gone through the same issue that you have gone through. So you don't have to stay in your issue by yourself and not speak out and not ask for help or seek for help or call for help. So we have people. I'm a mental health nurse. I'm also a counselor registered with British Association for Counseling and Psychotherapy. So you can call us and then we can help you. And we do signposting. If there's any issue that we can't deal with, we signpost you. All right. So today I'm doing depression in children. When I was a student nurse, I was giving, God bless you. I can see you, Sister Floris. God bless you. My dear sister, God bless you. Pastor Christian, God bless you for watching. I was given a scenario of 9-year-old girl to write about. I rejected it. Why? I said to my lecturer that I will not see material to write about a 9-year-old girl. What is her problem? Why would she be depressed? She's not married. She hasn't got any mortgage. Why would she be depressed? So I rejected it. And that is because I didn't know that children can have depression. So He laughed over it and went and bring another scenario, which is 46-year-old woman that was depressed because she lost her father. And I was like, 46. Why will you be depressed? You lost your father. 46. Celebrate the life that your father has lived, and then you move on. You are a grown-up person. You don't have to be depressed. But the point is that anybody can be depressed. Anybody can be depressed about anything, depending on the relationship that person has with the person that they are losing, or whatever thing that the relationship they have with whatever that is affecting them. If you have a very good relationship with your father and you lose your father, you can be depressed. If you have a good relationship with a close friend and something happens, God forbid, you can be depressed. But if we don't have understanding of all these things, people will be depressed around us and will not be able to know. Even just now, it's funny enough, I was just asking my husband to type something for me now. And when I was putting the heading something and I put children, he said, oh, why can't you change it to young people or youth? Because instantly you can see that he's thinking of how can a young person be depressed. So that is why I am discussing this topic today. That is why I am discussing this topic today, so that we have understanding, because majority of us, we have young people around us. So now, what is depression? Depression is not the normal sadness that we normally have. No, depression is not that. We can be sad sometimes, and when you sleep over it, the next day you'll be fine. Anything can happen at any time, you'll be sad. And before you know, you get out of it. But depression is not that. Depression is a complex and is a medical illness. It can happen to adults, it can happen to children. So we have to know that. Like, for example, a few years ago, we heard about a 9-year-old boy that commits suicide by hanging. People will be wondering, 9-year-old, why? Why would that person do that? But if that 9-year-old child is depressed, he's depressed. So a child can be depressed. A child, for example, a study said that a child can be depressed from the age of 3. And I reflect back, like, for example, if you have a child that constantly has something that is affecting them emotionally, they have something that is affecting them, they have something that is giving them pain, has something that is making them to feel worried all the time, that child can be depressed. When you pick your child to a childminder and you are leaving and the child is feeling sad, is worried because mommy is going constantly every day. If that child is not seeing any replacement that will make that child to be happy, maybe the child mother is very friendly, the child mother is very caring, the child mother knows how to take care of that child. As little as that child is, that child can be depressed because something is making the child to be sad every day, every time. So that child can be depressed. So moving forward, when a child is depressed, when you notice that a child is depressed, a child is sad, a child is not having interest, which I'll be talking about some symptoms later. A child is not having interest in what he used to have interest in. You notice that the child is being depressed, or you ask the child and they can open up and say to you that I'm depressed. You have to quickly do what we call early intervention. Early intervention. Don't keep that child to yourself, because I've seen a worse scenario, which is very, very sad. To me, when I met up with a one of our youth admission one day, I look at that child and I said that these parents are very wicked. This is wickedness. This young person was depressed, and the parents of the child will not allow the child to go to hospital because they don't want anybody to know that the child is depressed. You can't hide your child. You can't hide a child because or a person because they are depressed. Depression doesn't come. If you read depression, no, I'm talking about medical, clinical depression. I'm not talking about any just sad situation. When you notice that a child or a person is depressed, clinical depressed, you can't conceal it. It will be wickedness for you to conceal. And I will tell you why later. This guy that I'm talking about, this guy begin to isolate himself for 1 year in the room, and the parents will not tell nobody. All they do is they will take food to the child in the room because they don't want anybody to know. So early intervention, as soon as you notice that the mood of that child has changed, as soon as you notice that the mood has changed, ask for help. Go to your GP, ask for help. Your GP will not just start you with medication, because that is one of the reasons why people don't want to take their child out or don't want to let them know that they are depressed. They might not just commence you on medication. There's what we call talking therapy. There's what we call CBT, cognitive behavior therapy. Maybe the way the child is reasoning, the way you reason affects your body, affects your behavior, affects your emotion. So they will start you with talking therapy. You go and visit your GP. They will start with talking therapy. Counseling. You can speak to counselor. You can call counselor to speak to them. They will speak to them. By the time they start speaking to them and they begin to reason differently, their mood will begin to be lifting up. Their mood will begin to be lifting up. You can't hide it. You don't need to hide it because of stigma, because of what people will say. The longer you allow depression to go in somebody, the likeliness that that person will move to what we call long-term depression problem. The longer you allow somebody to be depressed without seeking for help, the longer you allow a teenager, a young person to be depressed, the likelihood that that person will move to what we call long-term depression problems. And what is long-term depression problem? They will go into using something that will lift their mood up by themselves. They will seek for help. You see a lot of youth around sometimes smoking weed, cannabis, substance misuse, alcohol, whatever. Sometimes you just look at them and condemn them, but you don't know where they're coming from. Some of the issue might be depression. Some of the issue might be depression. If they are not getting any help, if the adult around them is not giving them help, every human being, we are wired to conquer problem. We are not allowed to leave vacuum in us. We will go and look for how we will sort situation out. So they will look, when they are in pain, they will look for something that will lessen their pain. That's why you see that they go into using drugs sometimes in young people, even in adults. They'll go into using something that will elevate that pain, because depression comes with pain. It comes with psychological pains. It comes with physical pains. They will move. That is, if you leave that person, if you are concealing it, if you don't want people to see, or you are saying that you can't take medication. We know that medication sometimes gives side effects. Some medication give side effects, but they don't, according to NICE guidelines, you don't just rush into medication. In fact, in the community, they will have been nursing you in the community, nursing you, counseling you, therapy, psychotherapy, whatever. They will be doing all sorts. It is when it will not work, that's when they will introduce antidepressants to that person to use. So early intervention is very, very important. Early intervention is very important, so that the person will not move into long-term problem, alcohol, misuse of drug, and all the rest. Please, if you want to text some things, please text it. I will be looking, I will be checking on my Facebook. So what are symptoms of depression? If you want to begin to assess, you want to begin to monitor youth around you or children around you or adults around you, what are the symptoms? One of the symptoms might be that their sleeping pattern will change. They might begin to sleep too much or not to even be sleeping at all. Their eating pattern might change. They might begin to eat more or not eat at all. Some will be adding weight, some will be losing. Some will be adding weight, some will be losing weight. They will have sense of hopelessness and worthlessness. They will not be able to do even little tasks that they are able to do before. They will not be able to do it. When you begin to notice all this, then you have to begin to ask questions, direct questions. That direct question will be that you begin to ask all these questions to see whether there are some other symptoms that they are going through that you are not seeing, that is not obvious. You begin to ask about their sleeping pattern, ask about the way they eat. They will lose interest in what they like most. Maybe the child used to play football very well. You see that this person will be losing interest. And they might not be able to follow a task, even small tasks. They will not be able to follow it to the end. They will not be able to follow it to the end. Little tasks, if you give them little tasks to do, they might not be able to follow it to the end because they cannot concentrate. Their mood has changed. They will not be able to even tolerate emotions, whatever issue, maybe little issue that they confront, they might not be able to tolerate it. These are part of the symptoms of depression in children. And why is this happening? When children are growing up, when they grow into adulthood, studies said that as they are growing, it is natural biological maturation that is going on in their body, maturation that is producing in their body that will change their mood, change their body, and they will not be, because of those changes, and they have not grown to be able to tolerate and manage emotion. It will become a frustration when their mood is changing, when they are confronting some challenging issue in life. As they are growing up, that's when they will begin to face with some tough challenges of life. We were told when we were at school that if a child has tendency to even be depressed, maybe it's got a genetical reason why the person should be depressed. If that child lives around people that can support them as they are growing up in life, that person can grow into life and escape depression. If the person is predisposed to be depressed, tendency to be depressed because of genetical issue or factors, if that person lives around parent that is supportive, they will grow into life and they will escape depression and they will not be depressed. Because when challenges of life are coming, there are adults there that will guide them, support them through their challenges of life, and they will go and they will escape depression. When we do study of how people become depressed or have mental issue, there's an onset of when people start to be depressed, like or start to have mental issue. It might not even be depression. There's always an onset, and that onset is that when you go to a level where you have to face stressful situation in life, those are the time of the onset. Maybe from 16 years. For example, maybe you are preparing for your GCSE, or you are preparing for one exam, or you are going to university. Those are the critical stage of life. So parents, we have to know those critical stage of life. One of my child was going to go out of London to go and study outside. But because I know her, I said to her, no, you have to study at home. She was arguing it, no, I have to go. So at a point I called her, I said, it's for you, it's because of your personality. You are so socialite, so friendly. You go out with friends, weekend, you are going to cinema, this, you are going to that. So if you go out and there's no parent there to caution you, how will you be able to cope? Yes, aggressive responses. Yeah, that's right. That's right. So how will you be able to cope if parent is not there? And I'm going to move to another serious one now. Now that I just remember that scenario with my daughter now. So I said to her, I'm doing this because of you, not because of me. I know you want to move out. Every child they can't wait to grow up and move out to have their freedom. But freedom is very expensive. You have to know that there are some things that comes with freedom that you have to be able to manage. If you can't manage it, then a person can get damaged more than what the person is expecting. I said, because of your personality, you go to cinema, you go out with friends all the time, we have to caution you, have to say, no, you are going too much, face your school and this and that. Now you are going to university and you are going out. I don't believe you'll be able to cope outside. Thank God she accepted. She stayed at home. When she's writing her exam, sometimes both of us, we sat on the floor. Come and see drama when she wants to submit an assignment. And this assignment that she has kept for too long before she's not trying to submit it. But because I'm around, we'll sit down, we'll calm down, do it this way, do it this, just calm down. It's not the end of life. Just try. We'll be there on the floor before we finally submit into their system that they will. These are support that helps children as they are going into life and they are facing challenges of life. These are support that parent has to do to be able to support them so that they don't meet crisis. So that they don't meet crisis. For those that didn't believe that children can be depressed. So challenges of life that they are meeting step by step in life are part of things that can make them be depressed. We know that we have drug-induced mental health issue, but challenges of life, issue of life that they will face if there's nobody there to support them, to help them, or to understand that stressful situation can make them to depress, then things can happen and they will not know. Things can happen and the parent will not know. Okay? So it is very important for us to seek help. Please, parents, seek help. And again, mothers from abroad, that's another one I've seen. Mothers from abroad that are sending their children abroad. Sending their children to go and study abroad, come to London or go to Canada or go to anywhere. Please educate your child. These are another point of distress in life. This is another point of stress in life. When you are sending them off, educate them. If they are stressful, educate them how to manage life. There are better positive way to manage life than to go into drug. I have admitted so many that go into drug because they want to manage the stressful life because of the challenges of school they've gone into. And some might be that maybe they have been taking drug back home. Maybe they'll be taking drug back home. Maybe parent is not aware. So parents, if your child is taking drug back home, make sure you settle that case before you send them abroad. Because this is how I felt when I see children being brought from hospital, drug-induced depression, drug-induced psychosis, drug-induced mental health issue. If you know that your child is been taking drug back home, sort that out before you send them off. Make sure you counsel them, make sure you deal with the issue, make sure you manage the issue. They come off drug. you know that they have come off drug before you send them abroad. Because if they come abroad, they will come and try it again here. And some of these drugs that they take is like the way we eat is like the same way that we eat our fresh food back home compared to what we eat here. For example, the meat we eat back home is fresh than the meat we eat here. Fruit that we eat back home is fresh than the fruit we eat here. So also I believe that they might be taking some drug back home, like the cannabis weed, and it will not be as the same as what they will come and take here. Because I've seen so many that has been sent here, and before you know it, they will land in the hospital. And you begin to question, where do they start from? Have they been taking it back home, or do they just start taking it because of the stressful situation of school? You begin to wonder. And some of them, they just try it here because they can't face the challenges. So they try it here, and before you know it, they landed in the hospital. These are part of long-term management of depression, long-term problem that comes with depression, because they are depressed, they are frustrated, the environment or the work they are doing, the school work and all the rest is stressing them up, and the next thing is depressing them as well, and the next thing they want to do is to take drugs. So please educate your child, educate your children. If you know that they have that kind of issue, please deal with it before you send them abroad. Okay? Please, if you want to text, send something. If you have any question, please send. If you have any question, type it. Type it if you have any question. Type if you have any question, please type so that we can talk about it as well. We can talk about it as well. Okay? So if you find out that your child is going through depression, please seek for help. Depression does not just disappear. If it's clinical depression, it does not automatically disappear. You can pray if you want to pray, because I've seen a situation that parents will say the reason why we keep the child behind for so long is that we are praying. If it's not demonic influences, you have to ask for help, seek for help. If it's not an attack, if it's not a spiritual attack, if it's a medical or clinical depression, after you have prayed for so long, please take your child to the GP, ask for help. And there's nothing wrong in combining prayer and medication together. Parents, caregivers from background where culture, tradition play a role, need to be educated. Thank you, that's right. They need to be educated. They need to be educated. They need to know. They need to know. Sister Flori says symptom will be loss of interest, lack of focus, low mood, very agitated, or sometimes defensive withdrawal. Yes, they will be withdrawn. When you begin to see your child withdrawn, when you generally see that your child have changed, you can go to school, go to their school, because now I'm beginning to move to management and coping strategy now. Go to school. Yes, Sister Margaret said our people worry about stigma. Yes, that is selfishness. If you think that your people worry about stigma, and you keep your child in the house, the longer you keep them with depression, the more you are damaging their brain. The more you are damaging their brain, the more you keep them, the more their brain will be damaged. And the more you're giving them the room to move into something else to help themselves. A friend will come and tell them that this thing that you're going through, that has stayed with you for so long, persists. for so long, there's something you can use to lessen it. I've seen a patient that start cutting, and the patient said she's trying to move the psychological pain to physical pain because she can tolerate the physical pain than the psychological pain. That's how painful it is. So if you don't know that depression is very painful, that's how painful it is for the person that is going through depression to decide to shift the psychological pain to physical pain, because he can actually see the pain and nurse it. He can actually carry the pain to GP and they will address it, and they will dress it, and they will nurse it. But the psychological pain, he or she doesn't know what to do with it. So keeping them and say, oh, I don't want people to know, it's selfishness. In fact, it's wickedness. Because if it's you, the parent, you will find help. There's no way you will not go and find help. Counseling Made Simple is a platform that I've said that I will try to explain things as simple as possible for people to understand. So when I'm explaining some things, I will use some funny scenario because I want people to get it. Okay, you leave your child now. Because of stigma, you don't want people to know that your child is having depression. Let's flip it. If it's you that is having that depression, you will seek for help because the pain will not allow you to keep it to yourself. So it's like when they say, back home they do this program and say, when fire is burning you and is burning your child, the first thing you want to do is take away the one on your body. Automatically, that's how it will come. Yeah, that's self-harming. Self-harming. Cutting themselves is self-harming. Some will even do what we call head banging, because he wants to take away the pain, the psychological pain. He believes or she believes that when he head bang, he will head bang, and he will rather feel the physical pain in her head or his head than to be feeling that pain inside his head, inside the brain or wherever it's coming from. So early intervention is very, very important. Early intervention. Number one, start with assessment. How do you manage and protect and prevent depression from children? First, start with assessment. Assess your children. One day I saw one of my children woke up around 4 o'clock going to kitchen. I saw he walked past, went to kitchen, I'm hearing some sound. I got up, what is the issue? I'm not going to wait. I'm not going to wait to let it get it. Why would you wake up 4 o'clock and go and eat? Because one of the symptoms of depression is change of food, eating pattern. They eat too much or they eat less. They lose weight or they add weight. They sleep more or they sleep less. So assessment, assess your child. See if there's any changes in them. If there's any changes, you can approach their school to ask as well if there's any changes. Before your child begin to ask for help, and people will begin to offer them what to do. Yes, Sister Pastor Christian, prayer is good, but there should be a place for action. Yes, prayer is good. Pray, because there are different things that can cause, I believe, as a Christian, as a pastor, I accepted that the mental issue can be caused by demonic influences. Because I've seen people argue that every mental issue is demonic attack. I stand to be corrected. I don't believe that. I don't believe all is a spiritual attack. There are spiritual attack. The symptom might be similar because we know about the story in the Bible the man in the graveyard. We know that the man was self-harming, and at the end, Jesus came, killed the man. Yes, yes, we have that. And we also have the one that is medically, clinically depressed or clinically, medically illness, that when you pray, you have to take another action by adding combination to it. Adding to it. Prayer without work. After prayer, action should be taken. Prayer will even, I have, I don't want to say I have it. Arthritis in my leg. I take medication. I've been taking that medication now. Sometimes I don't take it, sometimes I take it. I've been taking it for long now. But one thing is that when I pick it, I will pray on it. I will say, every side effect on this medication is not my portion. That is prayer. And I'll be taking it, but by the glory of God, nothing. And I'll be taking it. So you can pray. You want to take medication for it, you can pray. That is the place of prayer. You pray for the medication to work for what is being prescribed for, not to work in adverse or advert. You don't want it to work in the other way. You can pray. Prayer is good in that way. Then you use your medication. When it comes to mental issue, people don't want to take medication. They want to pray, which is good, but don't want to have anything to do with pharmacological treatment. But when they have physical health issue, they go to doctor. When they have physical health issue, they go to doctor. They go and take medication. So coping and prevention is assessment. Assess your child. Don't let it get in before you get to detect. Don't let it to be too in before you get to detect. Assess, and as soon as you see, you yourself can even begin your counseling, your talking therapy, and before you know it, that mood will be lifted up before you know it, because you get to know on time. Check the way they sleep, their sleeping pattern. Check the way they eat. Speak to them. If they don't want to speak to you, ask them to speak to a family member or friends that they trust, that they want to speak to. You never can say they might have issue that they are going through. And no matter issue they tell you, no matter how small it is, don't say to them that, what is this? Why can this make you depressed? Why are you depressed? Why are you depressed? Don't look at the issue and say the issue is too small to make them depressed. Don't tell them what is making you to be depressed. You have everything. No, don't tell them that. It is their body. If it's making them to be depressed, it's making them to be depressed. Don't wait until it's like a wound. Don't wait until the wound begin to have infection before you begin to treat it. Some infection, as soon as it get into people, it kill them. So listen to them. Children can be depressed. The point in this video today is about children. Children can be depressed. Children biologically change as they grow up. They change. Their biological maturation change, and it produces changes in their mood and their emotion. And because they are still developing, they have no regulation skill to manage their emotion. Because of that, they can be depressed. So children can be depressed. The moment they have sense to know that something is worrying them, the moment they have responsibility, they can think of responsibility, and it is a stage. As soon as you see your child moving to another stage, maybe moving into university, you know that they are stepping into another stage of life that can be stressful. Those are stages of life. My daughter told me something one day and I was shocked. But I know that It happened, and that is why she said it. He said when they are doing their, I always miss it up, GCSE, whatever they do after their secondary school, we will do WAEC. So WAEC is stuck in my head. He said when you are in class, when they are in class and they are doing it, if any of the students falls asleep, according to their policy, they must not wake that child up in that classroom while they are doing that exam. Because you don't know, you might just, that 10 minutes, the child can fall asleep for just 10 minutes or 5 minutes, and that child will be awake again and continue. But the policy in their school says when they fall asleep, as they are in the exam hall, maybe 2 hours exam, if any child fall asleep, put his head or her head on the table, policy says don't wake that child up. He said, and some child will be there for 10 minutes, they'll wake up and they will continue. That 10 minutes sleep, you don't know what that has done to that child's brain. We African mothers, parents, we have this behavior of when our children say, oh, I can't continue again, it's too stressful, I can't continue this, my university. You will scream that no way, this must not happen in our house. You will not bring shame to our house. That's not how to deal with it. Let me give you a secret. My son was doing computer science for 4 years, did coding 4 years. As soon as he gets into year 2, he begins to say, I can't continue again. I can't continue again. It's stressing me. I'm losing it. As soon as he comes to us, I can't continue. Me and the dad will just say, if you know, my dear, if you can't continue, it's not the end of life. Just leave it. We'll figure out what you can do. Oh, coding is too much. Can't you see I'm declining? I'm reclining. I'm doing it. Can't you see my room? Everything is messed up because my head is this. We just say, don't worry, my dear. Just drop it. We'll figure out what you do that is not stressing you. Did you know that he finished, he graduated? For that 4 years, he finished his coding. As soon as you say, calm down, it's okay. We'll figure it with things out. Just calm down, it's not at the end of life. If you know the peace that will come into that child's head, you can never understand. But another parent say, no way, not in this house. Not in this house. You will not bring shame to the family. He finished, he even went and do his master. Not in this house, you can't do it. Not in this house. Pressure. Because they don't know how to manage it. So these are clues, these are strategies that I'm giving us for us to cope with our children and manage life with them without adding to it or be ignorant of what can make a child lose it. Okay? Okay. So I think that is I'm coming to the end of it. So that is it in nutshell anyway. That is it. The symptom, I've given the symptom of worthlessness, lack of interest, change in pattern, isolation, withdrawal. Those are all the symptoms. And children can be depressed. It does not matter how small they are. No matter, from the studies say from the age of 3, if the child of 3 years seen things that is making her or him to be depressed or to be frustrated or distressing, that person is chemical in the brain. It's about the brain. It's about the mood. So they can be depressed. And when they move into stages in life, when your child is moving into stages in life, you have to have this understanding that responsibility is coming. Sense of responsibility. The sense, I was speaking to one of my patients yesterday, one of them that came from uni, from abroad, came to uni, and is back in the hospital now. We just, how is everything? Have you spoken to your mom today? Yes, I've told you. How is things moving now? So he was referring back to if you know he will have concentrated more. I said, don't worry, you can start at any time. You can start all over again. You can start. These are stages of life. This is one stage of his life, university. Sense of responsibility. I must not fail. I must not fail my family. I must not disgrace myself. I must not be seen in certain. That sense of responsibility and the stress is there. In primary school, whether they fail or not, they don't bother. So they haven't reached that stage. That's why the onset of mental issue, the onset of it, sometimes comes around age 16, apart from the one that environmental factor affected. When they begin to have this sense of responsibility, that's when they begin to lose it. And instead of them failing, they would rather want to take something like drug if they are not well educated. You did not tell them, you did not sit them down, you did not educate them, you did not have clue that this kind of thing can be part of experience that your child will meet as they are moving on from stage to stage in their life. They will just go in it because they don't have, nobody has taught them the effect of cannabis, how it will affect them. They will go into it. A friend will just offer it to them and they take it. But if you, as a parent, you've known about it and you've said to them, you are going into uni now, you will meet different things, different people with different character. Your responsibility will be higher. But please don't do X, Y, Z because this will be the negative effect that can come out of it. You don't want to lose your mind and you don't want to, you begin to educate them. By the time they get there, instead of listening to friends that will offer them drugs, they will rather call home and say, I'm going through this issue. Then you'll be able to tell them what is the next step that you can do. Okay? Do we have any question, please, people online? Do we have any question to ask before I finish for today? Please, if you have any scenario that you want us to discuss, please email us. If you have any scenario, if you have any issue that you want, it might not be your issue, it might be issue of somebody that you've had and you're thinking, how can this be managed? How can this be done? How can we solve this issue? You can send us an email and we can discuss it. When we bring it to discuss, other people on the platform can put their input. They can put their input to be able to address that issue and that person will be able to move on. One thing I did not mention again is that depression can progress from mild, moderate to severe. And when it gets to severe, that person might begin to be thinking of suicide or to commit suicide. I think I speak briefly, but I didn't emphasize. It moves from stages to stages. Once it's going deep, deep, and deep, it does not just disappear by itself. Don't just be looking at somebody with depression and be expecting that that person will just come out. If that person snap out of depression, that means that person has not been clinical or medically depressed. That person, please share, please share, please share. Let people see it. Please share the video. So if the person snap out of it, if the person snap out of it, that person has not been clinical depressed. It has not been clinical depressed. Maybe just sadness. Just sadness if you snap out of it. But if the person is depressed, don't be waiting and be looking and say that person would. No, depression do not just disappear once it's clinical depression. If it's spiritual attack, yes, you pray, yes, that person can come out of it. But if it's something to do with the brain, with the chemical in the brain, and that person is clinical depressed, they cannot just snap out of it by themselves. They need help. They need help. And you don't want that child to move to long-term problem of depression, taking cannabis, alcohol. By the time they even treat their child for depression, that person might be hooked on drug misuse. That will now become another issue. Okay? All right. So that is where we're going to end today. If you, as I said, I'll be coming on every 2 weeks by God's grace. But I'm thinking if I have to change from Friday to midweek, I'm still thinking if I can change to midweek instead of weekend. So I'll be coming live with different topics. Please, if you have topics you want me to discuss, the email is on the bottom of the video. Please send an email. And the phone number on the screen as well. Please send a text and we can discuss it. And I will be bringing professional. There are some topics you will bring when you send that topic to me. I might be inviting professional to come and discuss it. Professional that has gone through the issue. They will come and discuss how they come out of it, how they went through it, and how they come out of it. I will be bringing professional. Please send an email. Tell me what you want us to discuss, and we will discuss it. Thank you for watching with me. Counseling Made Simple. Thank you. And I will be coming your way again by the grace of God. Thank you for watching. Thank you, Pastor Christian, for joining. Thank you, Pastor Floris, for joining. God bless you. Sister Margaret, God bless you. God bless you. I appreciate you. I appreciate you. Please help me share. Help me share. It's a burden in my heart. I know that people go through a lot of life issue. I just want to come and discuss it and bring professional to discuss it with them. We have a place, we have a functional aspect of our lives that need to be addressed. People are going through a lot of issue that needs to be addressed psychologically or need to be addressed therapeutically, and they need to be addressed by counseling. They need to be addressed by talking therapy. People are suffering in that area as well. So also as we have people suffering in the area of spiritual aspect of our life, we are not just one way, we are 3 ways: emotion, physical, and spiritual. So I have a body in that area that I've noticed that it's been an area of our life that has been neglected, particularly as a Christian, it's been neglected because we are not dealing with it the way we should be dealing with it. So it's a burden. So if you have a topic or you have a story, email us, send a WhatsApp, and we'll discuss it. And I will bring professional or people that have gone through it to come and address us with it. God bless you. Thank you for watching. I'll be coming your way again. Thank you for watching Counseling Made Simple with Helen Francis. Thank you. God bless you.